A huge organ about almost 1.5 kgs present in the right hypochondrium is the liver. This place is very sacred. Why? Because this place is where all the metabolisms happen. You take a drug, it's metabolized there. You want some proteins, it is synthesized there. You want some new glucose storage, or you want some iron storage, the liver is ready to do it. So let's talk about a cancer or a malignant tumor of liver. If that we are talking about, then we have to talk about the primary and the metastatic tumors of liver. The primary tumors which we are going to be discussing now is the hepatocellular carcinoma. The hepatocellular carcinoma, quite literally as we say, is because of the malignant transformation of the hepatocytes. And these hepatocytes can be changed into different forms. They could be serous form, they could be solid form, they could change the shape itself. They could, from a hexagon shape, they can become something else. Let's get into the details of it. This malignant tumor is predominantly seen in males rather than females. Well, the partly reason could also be because men drink a lot. The ratio is about 2.4:1. I'll briefly tell you about the major risk factors. It could be chronic hepatitis, cirrhosis, aflatoxin B, or non-alcoholic steatohepatitis. These are the major risk factors, but I would like to stress upon the cirrhosis part because alcoholic cirrhosis is a big problem. As we go ahead, let's talk about mainly the morphology. I'm going to be discussing about the morphology and the histology of HCC specifically right now. In HCC, the thing that should always come to your brain once you think about HCC is bile producing neoplastic cells. Bile producing neoplastic cells. Now let's get to the gross of it. So there is, whatever happens, there is always enlargement of the liver because this is a cancer. There will be a tumor. There will be enlargement of the liver. But this can be of unifocal type or multifocal type or diffuse infiltrative type. When you're talking about a unifocal type, here there is a large circumscribed single mass of the liver, and this is usually the condition where the liver is grossly very enlarged. Then you talk about a multifocal condition where you see multiple nodules which is dispersed all over the liver and it's of variable sizes. Then interestingly, we have the diffuse infiltrative one. Here, it generally involves the larger part of the liver or sometimes the entire liver, where you see homogeneous indistinct tumor nodules which are connected to each other and they're present pretty much everywhere in the liver. They're like, you can see them. And along with this, these tumor cells will blend with the cirrhotic liver background. The background is cirrhotic. Why? Because I told you the major risk factor for this was cirrhosis. So for a cirrhotic background, it will merge off and you cannot differentiate between the regenerating nodules of cirrhosis. Now, you're looking at it, you've seen the size and shape, that's how you have observed it. The next aspect to that would be color. And when you're looking at the color, you would see yellowish, white or gray substance. And it could be light brown also. But sometimes it could also become greenish brown in color for a reason because the tumor is, what did I tell you? The neoplastic cells are producing bile, and that's why there could also be greenish brown coloration. But as of, you have to remember, it could be brownish or yellowish or could also be greenish. I would like to add a different point here. I would like to add about AFP-L3, that is alpha fetoprotein lectin fraction of the alpha fetoprotein of 3, lectin fraction protein of 3. It is something which is highly specific. Like if this comes up, it could be in an MCQ, could be wherever, you should just remember that it is related to HCC. And this mainly talks about this alpha fetoprotein lectin fraction 3 mainly speaks about a poorly differentiated HCC, and the prognosis is pretty bad. Then we'll talk about, so we all also have to talk about the microscopy, right? So when you're talking about the microscopy, we always know whenever there is malignancy, the cell could be like the neighboring cells, or it could start getting, undifferentiated and go back to the core cells, the cells from which it was born, right? So According to that, the HCC is divided into three things: a well differentiated, or a moderately differentiated, or a poorly differentiated form. The well differentiated form of HCC, you can recognize the hepatocytic origin of the tumor, and there is bile production by the tumor cells. And that is the hallmark, as I've told you, bile production by the tumor cells is the hallmark of HCC. Now, this could be of two types of pattern. It could be of a trabecular pattern or that of an acinar. Remember, this acini is not like a true acini, but it's more of a pseudoglandular pattern. So it could be trabecular pattern or acini or pseudoglandular pattern. In trabecular pattern, there are several layers of malignant cells which are present in irregular anastomotic plates. Can you imagine a bowl of noodles which is all intermixed within itself? And that's how it looks. And within that, you have these nuclei which are hyperchromatic. Well, of course, hyperchromatic nuclei is something which is related to a cancerous condition. So you'll have a hyperchromatic nuclei with prominent nucleoli. Then talking about pseudoglandular pattern, in this pattern, the malignant hepatocytes are arranged in a lumen and it resembles a gland. But you know what? The whole of lumen can also have bile in it. And the acini which is formed by the tumor cells are not true glands, and that is the exact reason why we call it as pseudoglandular. That's all you have to remember, that there might be bile filled within the lumen and the glands are not true itself. They're faking it. Then you go ahead and talk about moderately differentiated HCC. Well, this could be of again three types of patterns. Could be a solid pattern, could be a serous pattern, or a clear cell pattern. When you're talking about solid pattern, you see variety of shapes. Hepatocyte is generally a hexagon shape, but doesn't happen here, sir. Here there is a lot of different set of shapes, and there might not be a lot of bile production. Then you talk about serous variety. In this, you see bundles of arranged hepatocytes, and in between them you have abundant fibrous stroma. This is the key word there. Then we talk about the clear cell variety. In this clear cell variety, you know what clear cells generally represent. They represent deposition of glycogen or fat. So here, that is what is exactly seen. Then ultimately, let's get to the third classification of it, is the poorly or undifferentiated HCC. Here you see pleomorphic cells of different size and shape. You literally can't recognize it. It's like, whoa, where am I stuck? I can't even recognize if this is a hepatocyte. And you can see a lot of anaplastic giant cells. They're pretty huge, and you can see the variation in the nuclei, the nucleoli. One thing which is kind of common in the cytoplasm of all these anaplastic conditions is the globular hyaline change. Like there will be a globular hyaline change, and that will be present in the cytoplasm. And that will represent what? You know, hyaline is generally a pink color and it's globular, and hyaline is generally deposition of misfolded proteins. So the misfolded proteins which we can expect here is the alpha fetoprotein, alpha-1 antitrypsin. We told about alpha fetoprotein of lectin fraction 3, right? So that could be it. So alpha-1 antitrypsin, and you can also see sometimes Mallory hyaline bodies. At a liver in a gross structure, you will basically see the gray-white tumor, along with you can also see some satellite nodules which are kind of present in the liver. And I will also tell you about an extra fact, that is HepPAR1. So this is used for hepatocellular carcinoma diagnosis. What is it? In brief, HepPAR1 is nothing but hepatocyte paraffin 1, and it is specific for hepatocyte mitochondria, and it is considered the most specific and the sensitive marker for normal and neoplastic hepatocytes. For normal and neoplastic hepatocytes, it's considered to be the most specific or sensitive marker. And also remember, you can always see some, as I told you, you could always see some area of necrosis and hemorrhage within the liver. When you're looking at the morphology of HCC, you'll always find some blood, there's some damaged cells, it'll always be there. So to summarize HCC, just remember, in gross, it's enlarged, could be of different types of tumors. When it comes to microscopy, it could be again highly differentiated, moderately differentiated, or poorly differentiated. You will find these globular hyaline bodies which are present, which is having alpha fetoprotein or alpha-1 antitrypsin in its core, and that does it. and that ends about the gross and the microscopy of HCC.